Hello, everyone, and welcome to Thorough Newspaper Analysis, which is brought to you by LawSikho. So, today we have only one article from the Indian Express for the discussion. The title of this article is Contagions in the Air. So, this basically talks about not only the COVID-19, but also the huge problem that is caused the health issue of tuberculosis. So, how paying attention towards COVID-19 can be a plus point for paying good attention towards tuberculosis as well has been discussed in this article. And the second one is News and Flash for a prelims exam. So if you're also preparing for judicial services examination, you can definitely have a look at the lot of the courses, which is the judiciary test prep course from LawSikho. The link to this course is there in the description box below. You have various benefits that would be coming along with this course, and you can download free study material right now as well from the landing page of this course. Also, we are excelling into various other courses like SEBI, CLAT, All India Bar Exam, etc. You can have a look at them too. So this is the multiple choice question from yesterday's discussion. Human Development Index is released by World Bank, United Nations, World Health Organization, or World Trade Organization. You can write down your answer in the comment section below. So this is the descriptive question for the day from today's discussion. Discuss how COVID-19 has highlighted the importance of spending into the public health care. Why such attention towards the public health care is a must. So these are the points in which you have to write that why public health care and a strong public health system is very important for any nation. So there is not too much to be discussed in this article firstly. So the COVID-19 virus has derailed India's efforts of many decades and diverted scientific attention from many infectious diseases like tuberculosis. So the first thing that we need to understand in here is that it is not just the COVID-19, which has been a viral disease or an infectious disease, or which is actually fatal in nature. Rather, there are a lot of such diseases which India had already been fighting against, and India had been reaching a good, a level as well in its fight. But since the time COVID-19 has come into India, we have not really been able to pay attention to any other problem related in the health sector, just other than the COVID-19. So as we know that the tuberculosis or TB, we know that in India as well, tuberculosis is a very, very huge problem. And specifically, if we talk about the people in the rural areas and the tribal population of the country, specifically the tribes that are from the Madhya Pradesh. So there is a huge problem of tuberculosis. But only and only we have been focusing upon COVID-19, and that is why the author in here says that we should be able to learn lessons from COVID-19, and on the simultaneous side, we should be able to tackle tuberculosis as well. So here we can understand as to how the attention that we've already given to COVID-19 can be treated as a plus point and an advance point in tackling the tuberculosis as well. So in the COVID-19 era, the public attention and priority which TB deserve will be significantly greater. So now as we know that, see, first of all, let's understand that what is the nature of tuberculosis. So tuberculosis is also a viral disease it is caused due to a virus, just like the COVID-19 virus. So tuberculosis is also many a times, actually it is fatal in nature if it is not treated at the right stage, just like COVID-19. Tuberculosis can also be caused due to overcrowding. Now, as you have written in here, the treatment for tuberculosis is a prolonged one. So it is not something like that, okay, fine, you have gotten tuberculosis, so you will take some medicines for a week and then you are good to go. Maybe if you are very good and immune, and if the tuberculosis is at the initial stages only, then definitely it might work. But if it is a prolonged or a chronic tuberculosis, it will need a good amount of medication. And that is why the areas, as we just discussed, the poverty-stricken areas or people in the country are more, on the verge of getting affected by the tuberculosis. Then other common thing that we have between tuberculosis and COVID-19 is diabetes. Now, as we know that in the case of COVID-19 as well, the patients who have other comorbidities, and specifically if they have diabetes or they have sugar to say, so they have a greater chance firstly of catching the virus and they have lesser immunity to fight the virus. And similar is the case with tuberculosis as well. Then pollution. Now, as we know that COVID-19 is the thing that affects the respiration and the lungs specifically of the patient. And if at all you're living in an area which is highly polluted and for years you have been living there, so definitely your system of respiration would not be as healthy as another person who lives in a less polluted area. And that is why your respiratory system would also not be that strong, and so COVID-19 virus would be able to attack you even strongly. And same is the case with tuberculosis as well, because it also affects the lungs and the respiratory system. You must have seen that many a times people cough a lot because they have tuberculosis, so because they're not able to breathe properly. So even in the pollution or polluted areas, both tuberculosis and COVID-19 are very dangerous. And of course, overcrowding, as we said, that it can spread from one person to another. So if you are we are we are living in overcrowded places, or we are getting too much into the social contact of the people who are suffering with tuberculosis or with COVID-19, so then it can be communicated to other people as well. So that is why these were the common points between TB and COVID-19. And that is why, if at all we are investing into the treatment or we are researching into the COVID-19, there is a high chance and good chance that we would be able to tackle and efficiently eradicate tuberculosis as well. So here we say that the tuberculosis is still more dangerous than COVID-19, because the mortality of tuberculosis is 13%, while for COVID-19 is still only 1.3%. Now you can imagine that what would be the total number of mortalities taking place due to tuberculosis. So more investments in health systems infrastructure, infection control, and personal protection equipment during COVID-19 will be handy in fighting tuberculosis. Yes, of course, because we are following all the norms. For poverty, we are trying to provide public healthcare system at cheap rates in the rural areas. Then we are trying to educate people relating their comorbidities and how much and why and how can they actually keep themselves safe. We're trying to curb down the pollution, and then obviously we are following the norm of social distancing, wearing masks, using sanitizers, etc. So all these steps that we are taking for COVID-19 can definitely help in putting down the numbers of tuberculosis cases as well. Then COVID-19 experience will boost TB testing at scale using modern tools. So obviously, now as we remember that very initially we had the RT-PCR test and only a few tests that were available for COVID-19 that were not only costly but also time taking. But over a year now, since we have been battling with COVID-19, so many tests have been developed now all around the world that are not only less time taking but are also cheap, and as well as are easy to handle and maintain as well. So this will definitely help in boosting the TB or the tuberculosis testing at scale as well, which would enhance the use of modern tools, and which would make it more easy. It would make it easier, as well as more comfortable for the people as well as the authorities to conduct these tests. And finally, the COVID-19 vaccine's speedy development and its platforms will bring tremendous hope for a TB vaccine as well. Now, as we know, there are different kinds of tuberculosis as well. So just like COVID-19 also is a type of the earlier that we had the SARS, which was severe acute respiratory syndrome. Then we also had the Middle East respiratory syndrome. So COVID is also considered to be a chain or a branch or a type of that kind of respiratory syndrome. So similarly, some vaccines though are available, but the very most fatal one, or for the most dangerous tuberculosis, we still do not have a very efficient vaccine. And that is why it is, we are hopeful that once we have the COVID-19 vaccine in hand, or even during the testing or during the development of vaccines is taking place, there is a good chance that research might also help in developing a good vaccine for the tuberculosis as well. So COVID-19 has taught the national and international leaders to prioritize public health care as much as curative and preventive. Now, as we know that we have two kinds of healthcare. One is the curative one is the preventive one. So in the preventive one, we definitely try to prevent any kind of disease. Just like when we are using masks or using sanitizers, we are using the preventive measures. And curative are once we've actually caught some kind of disease, then we are trying to cure it. So once, if at all, one catches COVID-19 virus, so he would take some good medicines, medication, and other things that are required to get treated from the COVID-19. So other than that, it is also said, and it is also actually taught the authorities, that we should already be spending good enough in the public healthcare system, so that the resources are easily available at good prices. Firstly, they're available, and next, they're available to everybody at par. So these are the other lessons that we have learned from COVID-19. Now, as you can say, social and spatial inequality. We have realized that because not everybody is able to get their tests done, they're not able to get even the hospital beds. But though the situation is better now since the cases are declining, but still it was a big problem. So it was less costly to prevent than to cure. So there are a lot of things that we can learn from the COVID-19 thing. Like we need to invest into the health and ecosystem and into the education, the industries, etc. So these are all the things that we have a good chance of paying attention to, and this is what is the need of the hour as well. With this, let's see what do we have for news in flash. ISRO launches satellite for communications. So the ISRO successfully places into a transfer orbit India's 42nd communication satellite, which is called as CMS-01, on board the PSLV C-50. So basically, PSLV is the launcher through which any kind of satellite is launched into the space from the second launch pad of the Satish Dhawan Space Center in Sriharikota. So let's see what is there about the CMS-01. It's a communication satellite for providing services in the extended C band of the frequency spectrum. So these are all the spectrums that are available for the communication purpose. Its coverage will include Indian mainland and the Andaman and Nicobar Islands. Now this can be a very potential prelims question as to what is the coverage area or the coverage zone of CMS-1 communication satellite of India. So you might get an option that it is only the mainland India or mainland India and Lakshadweep Islands, or Indian mainland and Andaman and Nicobar Islands. So it is the Indian mainland and the Andaman and Nicobar Islands. So this is the first among a series of satellites to be launched. So two more, that is Satish Sat and Unity Sat, will be launched soon. So this was all for the day. And if in case you would require this PDF for the slides for today's discussion, you can definitely join our Telegram group. So the link to this group is there in the description box. And this is our official website. So you can definitely visit it for any other kind of information. Thank you so much for staying tuned with LawSikho.